Okay. Good morning. Welcome. I'm Dave Kindig from the University of Wisconsin School of Medicine and Public Health and co-chair of the IOM's Roundtable on Population Health Improvement with my friend and colleague George Isham. Like to welcome everyone here in the room to today's workshop, and to remind you that this meeting is being recorded and webcast, and we provide a warm welcome to those of you joining us on the web. This is the sixth roundtable this is the sixth workshop that this roundtable has hosted in our about a year plus of operation. So we've been busy. We and our sponsors hope that this roundtable provides a trusted venue for leaders in the public and private sectors to meet and discuss the leverage points and opportunities arising from challenges in the social and physical environment for achieving better population health. We have a vision. You can see it on our website. We are hoping for a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision, that's a broad and challenging vision, it rests on the recognition that the outcomes that we seek, such as improved life expectancy, quality of life, health for all, are shaped by interdependent social, economic, environmental, genetic, behavioral, and healthcare factors. It's a complex equation, but our group is hopefully up to the task. And that challenge will require robust national and community-based policies and dependable resources to achieve it. We can't do it on volunteer efforts alone. So as one of our major activities, this roundtable supports workshops for our members, for stakeholders, and for the public to discuss issues of importance for improving the nation's health. As I mentioned, this is our sixth. And as you know today, so we've focused on previous issues, things like implications of the Affordable Care Act on population health. The report of that workshop is in the back. Health in all policies, catalyzing a movement, these kinds of topics. But today we're going to a different level and a different dimension. And we're going to feature presentations and panel discussions on the role of communities at the community level in population health improvement. As the California Endowment says, health starts here, right? Or health is done here. There is a large and diverse body of practical work and research in this area, and over the years, organizations and government agencies working with communities have learned from the history of social movements and community organizing that authentic community engagement is a critical ingredient in efforts to improve the social determinants of health and the built environment. It's not enough to survey the community or hold some focus groups. Community leadership, voice, and power are essential components of successful interventions. So that's what we're going to be getting into today. We, in addition to holding workshops, we encourage and stimulate discussion papers and perspectives that go up on our website from members and from colleagues who want to write on that. And today we are releasing on our website two discussion papers, one by Rebecca Etz called Engaging the Public Through Communities of Solution and Collaborative Empowerment. You can find that there. And then another one by Kelly Fisher and Steve Teutsch called Safe Summer Parks Programs Reduce Violence and Improve Health in Los Angeles County. In addition, we're also releasing today workshop in brief report. When we do our workshops, in addition to having fuller reports like the one I mentioned from our first workshop that's available, a little booklet in the back, we're beginning to report what we call reports in brief. And the one that's also on our website today comes from our related workshop in December called Supporting a Movement for Health and Health Equity, workshop in brief. And so you can find that on our website. Looking forward to today. If there are any logistics questions, talk to our staff in the back who are wearing green name tags. Otherwise, we'll get forward. And I'm next going to introduce Mary Lou Goeke. She's a member of our roundtable, and she chaired the planning committee for this workshop, and she's going to now provide us an overview of the agenda and a context for our topic. Mary Lou is the Executive Director of the United Way of Santa Cruz County, California. Thank you.
Thank you, David. Good morning, everyone. First, I'd like to thank our really excellent planning committee and our amazing IOM staff who really made it so effortless for us to work together to put together the very best representation from across the country of communities improving health where they live. Our planning committee roundtable member George Flores was part of it, as well as Kate Hess-Pace, Melissa Simon, Julie Willem Van Dyke, and their bio sketches are in your materials today, as well as the bio sketches of our speakers. The role of the community in improving health was depicted by two IOM committees in 4 different reports between 2003 and 2012. A first committee developed, and then the second one revised, a figure of a multi-sectoral system in which public health, health care, community, business, and other stakeholders are shown in a circle working together toward the goal of healthier people. The 2003 report used a framework of collaborative action that endorsed a notion of shared governance through which the population health would be improved and truly owned in partnership with community members. We had so many options in thinking about who to bring to speak today, because all over the country there are community groups and organizations involved in really noteworthy and effective ways of improving their livability, their wellness, their health, and other characteristics they want to improve in their communities. So we're going to be featuring a few of those community leaders today and their organizations, and they're going to tell you about their work. And we were most interested in showing that this work is going on across the country. So we have representatives from California, from Kansas, Louisiana, Minnesota, and Michigan. And we're dividing our workshop into 3 focus areas. The first will be talking about how young people are engaged and contributing to the health and well-being of their own communities. And then we'll talk about how community organizations are tackling the social determinants of health. And then finally, we'll talk about how institutions and organizations are working with and supporting community people for improvement. I'm just so pleased that we were able to get our keynote speaker today, Manuel Pastor. He's going to share with you his research and his insights about the power of communities in improving health. And our community is actually one that for many years when he was at UC Santa Cruz, he worked with and helped. So I can attest to his wonderful gifts and talent. He currently, after leaving us, which we're still not quite over, went to University of Southern California, where he is professor of sociology and American studies and ethnicity. He's also the director of the Program for Environmental and Regional Equity and the director of the Center for the Study of Immigrant Integration. So it's with great honor I introduce Manuel Pastor.